Well, I was a scrub tech. I was in the medical field too.
Oh. So actually, you are a medical
I was in the
professional.
medical field. Yeah, so I was a scrub tech. Yeah, so I was
So wait,
the
what does that entail?
surgical technician. So I was the
Oh.
third assistant from the doctor. So it's the surgeon, the PA, and then the surgical technician. So it's kind of like a maintenance tech.
How'd you
You're
get
just
into that?
handling- Nights. I didn't want to be in the streets no more, so I got myself into studying. So I was
Oh.
working. I had to keep myself busy. So
That's an
you know,
interesting job.
I've done some shit, bro.
I'm really squirmish. Like I can't do blood, bro. I couldn't do that. Did you stand there and just like watch these surgeries happen?
I was there. I worked actually like about 3 years to almost 4.
Mhm.
You know, I was lucky because the doctor actually picked up on me, bro. I was like, fuck yeah. He didn't judge me. He didn't tell me nothing. He's like, yeah, you know, you're a smart motherfucker. You beat the assistant that I have. I was like, oh wait, what? He goes, yeah, I've been having issues with them lately. I was like, all right, cool. He goes, I'm gonna get you, but I'm gonna show you everything. I was like, perfect, show me. He goes, I just don't got instruments. He goes, don't worry about that. I have them all. I was like, all right, cool. I was like, perfect. Let's go do this. He taught me total hip replacements, knee
wow.
replacements, plastic surgery. I did actually OBGYN for about 6-8 months
Oh, sick.
with him. I did ER nights, graveyards.
Damn.
So I seen some shit there too.
Oh my. What's the craziest thing someone ever came in for? that you saw?
Fuck. You want funny or worse?
I think both, honestly.
Both shit. Motorcycle accidents, car accidents, truck driver accidents. Yeah, you name it, I've seen it.
Car stuff is brutal. Anything on the road is tough.
Yeah, we've seen people get there in pieces. We've seen people get there with arms hanging.
What's
This
the
and
craziest
that.
injury you've seen someone survive?
Dude, a guy get hit with a bar, just go through him like that across his chest, out the back of his lung. I don't know what the hell happened. He said he went down the hill or something. I guess they were out there messing around 3-4 in the morning, hanging out at the hill. I guess he just went down the hill, and big old tube. I guess he just cranked into it. They brought him. They said to the helicopter. So when we received them down there, we're just like, holy shit! They already had grinded a piece of the pole off. We're just like, this mother, and it traced his ass, missed almost everything.
Really?
But just the only thing, since it kind of went through a little bit of his throat, clavicle, all that had to be replaced with it.
Was he able to like speak? Like, what was his?
Because they put him he got there unconscious. His brain was swelling, so we had to do cranial open. Let his brain.
Do you think like long
swell,
term he was
so-
able to speak though, or like?
When he left, he went back home. Okay, but he
Really?
needed a lot of rehab. He needed a lot of rehab. Half of the body kind of drooped a little,
Yeah, I
so
mean-
he has to get that back. But
my
I seen some
God.
crazy shit. Some funny shit too. Guys, girls, stop playing with your fucking dildos and leaving them in there.
Oh,
Like,
how often
goddamn.
did that happen?
A lot, man.
Really?
Yeah, cucumbers. I've seen girls shampoo bottles.
What's the worst thing?
Their
that you ever
beads
saw?
getting stuck in there. We have to go in there and get our tool and drag them all out.
Oh my God!
Yeah,
No.
Put them incline, head down, ass up, anal clamp, and you open them, and you gotta grab them out. You gotta get them out. You in there, you do X-rays. You gotta see how you're gonna retrieve the stuff out. And the doctor puts them ready. Everybody sets them up for us, and we get in there and time to retrieve it.
Oh my God!
Yeah, we've seen some guys too. Same thing.
Has it ever gone like so deep that it caused real damage with someone that you operated on?
On some people, yeah. Some people they get damaged. Some of them, some of them we had to cut their ass opens a bit more, and it's part of the procedure. You tell them like, hey, if this shit don't come out, we're gonna have to like cut you open and let you know your ass is gonna. We'll put it back to normal, but just know you're gonna be in pain, and this is gonna happen, and this is what we're gonna do. And you let them know the procedure and everything.
Yep.
So they're just like, holy shit, like what's
Oh my!
labor and delivery too, like the OBGYN, girls having babies. It's that was a nice experience,
Yep.
you do. I've had about 4 of them where it was emergency C-section where we're just like, all right, girl's not opening, sorry, we got
Time to lock in,
time
yeah.
to lock it in. You put them asleep, you sedate them, and let's go,
Damn.
You know, because there's a lot of complications too. You know, they can be caught with their.
I'm so glad I'm a
intestines and
man,
stuff.
bro. Giving birth is so scary.
You see
Holy
it, bro.
fuck,
It's like holy shit.
I'm so glad I don't have to do that part, dude. My God.
Yeah, man. I've seen some stuff.
Fuck. I just can't imagine my ass getting cut open like that. I just keep
I don't
thinking
even
about
want to
that.
picture
and,
or know
bro,
it or
like,
nothing,
nah,
bro.
I can't, dude. I've never even heard that term. Like, oh my God.
Yeah,
I've never
you see-
considered that you could medically need that to happen. Like, that's just.
Yeah,
cut my ass
you'll be
open.
surprised. You'll be surprised. Yeah, I've seen a lot, bro.
Holy fuck.
We had to take like girls' implants too that they pop because they get silicones.
Out in LA, there's probably a lot of
A
that.
lot of that, you know. Yeah, we've gotten girls where they've been infected.
The
from
BBLs
it,
that
the
went
BBLs
wrong.
that went
Yeah.
wrong. Where'd you go? Oh shit! I went to Mexico. I got
Yep,
my ass.
I went
and
to
my tits
Brazil.
done. Yeah, and they want to be you know, nice and good, but
Yep.
some of them, for the cheapness, that's what you get, you know.
Yep, that $500 BBL special. Cement.
Yeah, for real.
You ever see any of that? Like crazy stuff being injected into people that you had to like operate on after?
Not much. I seen that on one girl. I wasn't part of the procedure, but we were
Mhm.
looking through the window. Her butt, she would inject it, and they were talking about it, how it got so infected, and they were just injecting. They would do it at home. Their ass got so infected, they had to swipe half of it out because of the infection.
Oh.
Yeah, so they go in there. It's like liposuction again. You just go in there, start getting everything out, removing stuff that's bad, and reconstructing the body again.
Oh my God.
And then picture that not sitting for months on your butt.
Yeah.
Either
You gotta lay
standing
flat
or
on
laying
your stomach
flat.
every.
Yeah, man.
Oh God,
Yeah,
dude,
that's-
I couldn't do that job. Like, I don't know how you do that. I could not. I would throw the fuck up.
Damn.
Like-
Yeah. Well, look, there is, and this is true. It's from doctors to doctors.
Mm-hmm.
There's some sloppy ass doctors, fucking blood everywhere, and there's some clean ass doctors where it's like, shit, dude, where's the blood at?
Really?
And you barely even dirtying your gloves.
So you just got to be with an efficient doctor that. knows what
Yeah,
they're doing.
because not everybody knows how to operate. Some are just like, fuck, I'm just getting in there, sloppy, fucking throw me another bag of blood. And it's like, nah, dude, you're losing the fucking patient's blood in there. And there's doctors like, hey, we're going to wash the blood. Keep me 3 here just in case. To not put them up unless I say. Sometimes they don't even lose all that blood because they know what they're doing. They go in there, they open up nice and clean. They cauterize what they have to cauterize, and boom, stop whatever bleeding needs to be stopped. They stop it. We re-clean, and then you get back in there. You're working with something visible.
Yep.
Versus working on something sloppy, you know. I got to see all the organs in the body. I've done pacemakers.
Oh.
Yeah, I've done neuro.
God.
I've done a couple of neuro surgeries.
Brain
Yeah.
stuff. I couldn't imagine like touching a brain.
Well, you just gotta, you hold certain little tools. You're not.
Yeah,
physically
yeah.
there 'cause
You're
it's
not
a
like
doctor's
poking
job,
it,
but it's like you're in there and you're just like holding whatever you gotta
Oh.
hold with them, or either suctioning, because I got to suction all the time. I was like standing there and like, you have the brain in there. It's like it looks gummy. It looks like a bubble gum, like gummy,
Really?
like little worms. Like it looks cool. It looks crazy. when
So
you're
how I've
looking
seen
at
it in the movies, you'd say it's kind of accurate. Because I'd say
Okay,
how I've seen
yeah,
it in the
kind
movies,
of
it does kind of
accurate.
like
They add a little extra spice to it, but it's kind of accurate. Yeah, it's
God.
it's cool. It sounds sloppy if you don't have a stomach for it.
Yep.
I've seen some.
Oh,
people
I
just
don't have a
collapse.
stomach for it.
Yeah, when I was
So.
doing my hours and we were in there doing our hours, we are just like, oh, shit. I seen some people like spinning circles, oh, and you just hear thunk. They're in the back on the floor, like, oh shit, bro, you okay? And you can't turn around because since you're sterile, even us when we're in there, they ask us, you gotta be with your hands up, because we're sterile. In case they ask us, hey, I need you, you have to be on the table, maybe a foot apart, and you can't be next to the surgeons or the people that are doing that, just so you can cross contamination.
So whoever fell down isn't sterile anymore.
Yeah, and then the RNs are the ones that will take care of them, or the anesthesia person that's just sitting away. They'll take care of the guy that fell. So you can be like, oh shit, like he
Yeah,
fell.
yeah.
Like, oh damn, my bad. Not everybody makes it in there.
Damn.
Not everybody.
Oh my
Yeah, 'cause
God.
it does boil your stomach. The first time I was like, oh shit, we're really gonna open this corpse, because we practiced on a warm, fresh body that didn't make it. We're like, all right, cool, we're doing this. And once they open, that's where you start feeling like, okay, I think I can do it. And if you don't, you'll pass out. You start getting lightheaded and you're gone. Whoop, you pass out.
So how long did it take you to get used to that?
Oh, same day. I asked him for
Really?
me to cut the body open.
Oh my god.
Yeah, it's like, all right, do the incision here. All right, you ready?
You just had a stomach for it.
I just went in for it. I don't know if I had the stomach or not. I went in for it. I was like, oh, this shit's cool. All right, next. You go in there. You go in slowly. You know, you're cutting. The body's still warm.
Yep.
You know, so the person just passed away. So now you got to practice. And you're just like, oh, shit. Like, it's happening. Like, it's going. You
know? For the people who are like, let's say, organ donors, or they volunteer their bodies for science, that is essentially what they're going to?
They're going for. So you have the actual doctors there to retrieve the parts that they need, maybe for a procedure that's coming up, or someone they already have in line. You know, so they'll pick if the body's worth keeping, and they're not sick, and they don't have so much stuff in their body, and they know it's not going to affect the next person. And if it's a match, they take it, they put it up, and you take it right away. They transport. If not, they get them and they freeze them, they save them.
Damn, it's a crazy industry to be in. Like,
but it's crazy how it works, because when the body is fresh, they have someone right away for it.
Yeah.
Right away, lined up, waiting for it.
Wasting no time.
They waste no time. Oh, we need fingers. We need the intestine, or we need whatever, you know. If everything is good to go and they have what they need, they'll take it right there and then.
Damn.
Yeah. Sometimes they'll bring the body in. Hey, we're here. We still have them in here. They'll do the double. They'll do it there and pass it on right away.
And after you're done, like, doing whatever with the body, what's done with the remainder?
Well, you close them up and you return them to the family.
Yeah.
Yeah, because you got to open them up and then you
take,
freeze,
you organs or whatever you need to. Yep.
Because once they're a donor, they're actually giving you the permission to do that and stuff. You know, so they take whatever they need.
You ever seen some real bad organs get pulled out? Like some fried lungs and stuff.
Fried lungs, all beat. They do get fucked up, like they say. They get bad. Intestines, swolled up, infected.
Oh.
I've seen this pretty bad stuff, I've seen how cancer looks, bally, all disgusting, how it eats up the body too.
Is there like a smell to this?
Kind of. You can smell the body of it. You can smell like the reaction of it. Like, I don't know how to explain it, but it starts smelling.
Yeah.
So
there is like odor. A distinct kind of smell of a body while you're doing this kind of work.
Yeah, you get it. It's like I don't know if you get like the body's odor, and you know it's not normal, and you're just like, oh, okay, like no. So you gotta like put on a little mask, because it's bad to be breathing a dead body too.
Yeah.
It's really bad. So.
And how different is that smell to like when you're operating on a live person, and you cut them open, let's say? Like, is there like a smell to that? Is that mainly just blood?
It depends how long they've been sitting. If they're fresh, if they freeze them, then they bring them out, and when the body starts, defrosting them, it changes. You get a different smell and stuff. But kind of when they're fresh, kind of the same when you're operating, but the body it just drags. It just completely
interesting.
What it's doing. It's like you just hit the switch, goes pitch black, done. So you can feel the difference on the body weight as well too. They get heavier, way heavier. But the odor when you're operating, you're just smelling more of what we're doing, because we're cauterizing and you're suctioning. So either way, you don't smell it as much because you're all messed up anyways.
True.
So you don't really get the smell. But when you're done, you just get like an operating smell, like in there. And stuff.
I would imagine I just get so nauseous in that bitch, bro. Oh
I would go have my lunch and be
I'd
like, hey, I want to get back in there.
Oh, I couldn't eat no lunch after that.
Like, hey, you're eating? It's like, you're still chewing and walking in. I got to be in the procedure right now in 20 minutes. Like, I'm still chewing my food. And then just because I wanted to be in there, because the doctor's like, hey, bro, you got to eat quick. I was like, fuck this. I went outside, standing outside, ate my lunch in the hallway. And went in right when it was needed.
You're just built for that shit, it sounds like.
Yeah, probably, yeah.
Damn.